Over the years, having worked in NHS for about 30 years and took early retirement, I thought I had a lot of energy that I could take back home. I couldn't sit around, eat and sleep.
Hello, welcome back to the Chronicles of a Ghanaian Diaspora Nurse, The Return. Thank you so much for tuning in again. My guest for today is someone that I've known for quite a few years now. She's based both in the UK and in Ghana, and I'm so excited to have her tonight, especially with the conversation that we are going to have about the process of going back. And hopefully she will share her experiences and then we will learn something from it. So Mrs. Josephina Ababio, welcome to the channel.
Thank you very much, Rita, for inviting me onto your program. I'm excited to be here.
Could you please tell us your current professional role and how long you've been a nurse for?
My name is Josephina Ababio, and I have been a nurse for 41 years. I was trained in Kolebu, the world best nursing training school in Ghana. From 1980, February, when I completed SRN, I went to Ankerfo in August 1980 to do my RMN training. And when I completed that in February 1982, I went to do work in Pantan Hospital a little bit. And then I started my midwifery training from 1982 November till 1983 November. And after that, I came to UK, stayed in London for some time, and I did my adaptation at UCLH for 6 months. So from June 1984 till today, I have been registered nurse with NMC. Currently, I am Chief Executive Officer for Care Agency. It's a domiciliary agency, and we've got supported living branch as well. I did retire as a modern matron and took this role on. So this is what I'm doing at the moment.
Thank you so much. Wow, 41 years combined, both Ghana and UK. So, I mean, in all your nursing career, what would you say has been your greatest achievement?
My greatest achievement, I will recall when I did my district nursing training. It gave me the impetus of working as an autonomous practitioner, that you can change and contribute to the health of your patients, and also lead a team of nurses, manage them, and make a difference in your patient's life, and develop the nurses as well for them to deliver quality service. So that was my achievement, and that was the initial one. And when I became the matron, also being part of change in the organization, because it was a time that it was very difficult to get a lot of BAME nurses, some of them, especially the African nurses, for them to get into senior management role. So for them to see their kind in middle management, it sort of made them emulate, and I was able to encourage them to get into that position as well. develop themselves. So that was one of my greatest achievements. I was able to encourage people to develop themselves. Yeah.
That's really great. So you've definitely given your quota to the NHS and
Yeah.
all these experiences, and no wonder you would want to give back. So that leads us to the next question: is what inspired you, to have the idea of wanting to go back to Ghana and do something in the healthcare sector?
Over the years, having worked in NHS for about 30 years and took early retirement, I thought I had a lot of energy that I could take back home. I couldn't sit around, eat and sleep. So I went to Ghana with a view of establishing a nurse-led clinic. But my mistake was not doing enough research about that. So though I had the premises to start, when I went to register, then I started facing the challenges of going to do my registration, return to nursing registration. And I did take the initiative to go. But the challenge was that having to go to the hospital to work for 6 months, I did suggest to the nurse, development nurse in that hospital I went to in Accra, if they could let me do like 3 long days a week. And she said, oh no, I couldn't do that. I have to do all the 5 days, Monday to Friday. I thought, it's very difficult. I don't think I can do that with the traffic.
Can I
So I
just
did that
ask,
for 2 days.
was it part of the um adaptation, like
Registration,
registration,
yeah,
and you had to
yeah,
work for 6 months?
yes.
Okay.
And so she told me I would do 2 months for midwifery, 2 months for general, and then 2 months for psychiatry. So with the psychiatry, I knew where I live, I could go, it would be easier for me. But then I wanted to do something in general, more or less. So I was more eager to do the general return to nursing, but the challenges of me waking up very early and traveling to Accra every day, I couldn't face that. And that was one. And two, going to register. Over here, when you want to register, it's very easy. The processes are there to follow. But I realized that sending the application form, you wouldn't get any letter to,
Knowledge.
to acknowledge that they have received it. When you call the office, no one is replying you. They come to inspect your premises and they come like all time. 6 a.m. somebody came to inspect my premises. And then after that, you didn't hear nothing. And so I was frustrated. And then I decided I have to leave. And again, I made a mistake by going to Ghana with a lot of equipment and consumables and medicines, because the plan was to open up and start a clinic. So I didn't do the research well enough. So then I was concerned they would expire, the medication would expire, and the consumables, they've all got expiry dates. So I started giving to some of my friends who were matrons in some of the hospitals, and other friends who had chemical shop with the medication as well, over the counter medication that I went, and just close up and return, put the rest of the equipment in my garage and return to UK.
Okay. That must
Yeah.
have been a very, not very pleasant and probably discouraging situation. But I just wanted to touch on two things about the NMC registration process. How long ago was this when you
This
tried?
was it was 2012.
That was
2012, yeah, towards
yes,
the
now.
end of the,
Yeah,
yeah,
yeah.
yeah.
Because my understanding is that the processes are now things have improved, and most,
Mm,
and I went on the NMC Ghana website and I could see that things are efforts are being made to improve. I'm not sure about the process itself, and I'm hoping that I will get somebody from the NMC Ghana to probably talk us
mm,
through the appropriate process. But I didn't even know that you had to do like a 6 months and do all these
mm,
shifts.
yeah.
Yeah. So obviously, this was a discouraging situation for you.
Mm.
But I also know that you haven't given up. And I know that you are going again. So,
I haven't given up. I haven't
yeah,
given up at all, because in a way it was good for me, because I wanted to do this in Ghana. But when things didn't improve, I returned. And that gave me the chance of going back as an independent contractor, working with continuing care in another borough, and then gaining more experience to open my own. And now, having done managed my own agency for 5 years, I have gained more experience in establishing your own business. And I have done a few research, and I still want to send nursing in the community, nursing in the home, that concept in Ghana. It's picking up. I know a few people who have started, and I want to do that because Ghana is my home, and I want to go home and do something. So this time I'm going. And also I realized that you need the network, the local network. And when I went 2012, I didn't have a lot of links. I knew a couple of my classmates, that was it. But now, having joined the old school platform and things like that, it's giving me a lot of leverage, the people I could touch and contact, and make things a lot easier for me. So I'm going to try the second time, and I'm sure it will work this time.
I am encouraged and I'm rooting for you. And I know that, the saying that every misfortune is a blessing.
Yeah.
And, like you said, when things didn't work out, I mean, so it seemed at the time, and you came back and you had to go and work in another sector, gain additional
Mm,
experience and skills, and now you're going back more equipped than you were
yeah.
the
Mm,
first attempt. So it's really, really inspiring. I was going to ask you, what tell us some of the lessons learned, but I think you've talked about that in all that you said. But do you have anything else to add, especially to people who have either been in your situation, had gone and then faced challenges and come back, or even people who haven't made attempt yet and are thinking of going? Some of the lessons learned, if you can just summarize so that, yeah, thank you.
yeah. I think it's very important to do your research and speak to the right people. Also, you need some local champions for support. because without them, you can't function in Ghana. You also need your financial backing. It's very, very important. And that is what I would advise, that you need to do your research, know the processes, and have a network, local champions, and the financial support. Yeah.
Thank you so much.
And you must have time and patience, because things don't happen easily in Ghana. It's very easy over here to sit at home, send messages, internet, and you will get response. In Ghana, you must give yourself time. Sometimes when you send when you send the email or application form, you need to follow up as well, because things don't just happen.
This is really, really helpful. Thank you. Thank you for sharing your experience, and I'm sure that it will definitely help somebody, to make the right decisions about going back and giving back. Okay, so the last question is, what would your general message be for all the health workers in the diaspora, or the African health workers in the diaspora?
My advice would be, Ghana is our home. And it's not everyone who can go and do something. But even if it's a group, I find that to joining a group for you to go, because not everybody has the support to do independent work, but groups will be able to join a group to give something back is very important. And also the people at home appreciate some of the support that we are giving. The only thing is that we have to include them. We don't have to go and lord over them. So when we are going, we have to have the mindset of we are going to work with them. And that would support them very much. Yes.
Thank you so much, Mrs. Josephine Ababio. Thank you for your time. I'm sure that this has helped someone, and hopefully we'll catch up again and see how the services that you are intending to implement in Ghana, how it's going. Maybe we can come over there and do a coverage.
And thank you for having me. Thank you.